Welcome to the Whispering Podcast, where our goal is to change the volume on some of life's most difficult conversations. This podcast is brought to you by WISP, an online telehealth community for women and men looking for reliable and discreet online care for their sexual and reproductive health needs. Log on to hellowisp.com and get same-day prescriptions for UTI, yeast infections, bacterial vaginosis, oral herpes, aka cold sores, and many more. Medication can be picked up at a local pharmacy, or you can have meds shipped in discreet packaging directly to your home. Online consultations only take a few minutes, and all medication is prescribed by U.S. licensed doctors for all 50 states. So when it comes to the certain types of sex that you have, can that impact whether or not you will or will not get a UTI?
The answer is sometimes yes, sometimes no. So there's people out there that, like with some of the anatomy issues that we just talked about, it doesn't really matter what type of sex they have. And there are people out there that no matter what they do, they're just going to get UTI, and they got to take antibiotics every time afterwards, and they have to go to the bathroom, and there's nothing they can do. But we know that a lot of UTIs are caused by E. coli, which is a bacteria that lives in the GI tract, in the colon, in the kind of the rectal, anal sort of area. And for people who aren't at a baseline predisposed to just getting UTIs, having anal intercourse or anything that causes potentially movement of the bacteria from the anal area to the urethral area. So the kind of, we say like not wiping back to front. It works that way with sex too, right? You work back. And so, having anal intercourse or anything involving the anal area first, and then moving to the front, that can move the bacteria. Even not showering or maybe having a long work day beforehand, if you're sweating, if you've been working out, if you've been in the same clothes, sitting in a bathing suit beforehand, all that increases the likelihood that bacteria could move from one area to the other. And so, yes, for some
it's
people,
just like, damn. Okay.
I know. What are you gonna do?
It's just usually at this point, what can you do? You can't win for losing. Because I was what was I on? I think I was on TikTok. It was something funny. This girl, she just walks up to like random guys and asks them questions. And I think the one question she was asking them about is how they wipe. And one guy said that he wipes from the opposite way you're supposed to. So I think it's back to front that he was doing. And she just kind of like looked at him like, you do what? And he was like, it would be too weird for me to like go from front to back. And I'm just like, no, babe. like no. So it's just crazy how people think the normal things that they do, there's no issue about it, but there is. So it's just like a lot of people really don't understand like those type of things of how you wipe after using the bathroom. All of those things play a huge role in how it could affect your partner or anybody that you're dealing with after that, or even yourself. So yeah, that was just a wild thing. But okay. So say you get UTIs all the time. Are you taking too many antibiotics? Because I know in the past people would always say you need to take probiotics and antibiotics at the same time to kind of like balance it out. So is it because that they're taking too many antibiotics that they keep getting the UTIs, or is that not even a factor that plays into it?
Sort of. Let me explain to you how it works. So the problem is that there's a lot of different types of bacteria that can cause a UTI. And different antibiotics, the way that it works is different antibiotics have different bacteria that they are capable of killing. And a lot of times we guess and we assume that it's E. coli, because I just told you 5 minutes ago that E. coli is the most common one, but it's not the only one. And the medications that we choose, like macrobid, super common antibiotic, kills E. coli, and that's it. Doesn't kill anything else. So I'll throw out some words here. You can have a strep UTI, like a group B strep, which is really common down there. You get tested for it when you're pregnant. Klebsiella is another type of bacteria that can live down there. It's a big word. There's other ones, Enterococcus, which is similar to E. coli, but not all antibiotics work the same. And so if you are somebody who, and that's why we will order what's called a urine culture, because a UTI test just tells us positive or negative. Is it infected or is it not? And
Mm-hmm.
sometimes we just go ahead and pick what we think would be our best guess antibiotic, and we might get it
Mm-hmm.
wrong if we don't know what the bacteria is. So, and at
Yeah.
WISP, we have the ability to order a urine culture, which
Mm-hmm.
grows out the bacteria and says not only this is what's in there, but
Mm-hmm.
what is the antibiotic that kills it. And
Got
that's where
it.
we get in trouble. When we prescribe antibiotics that don't kill the bacteria that's living in there, yeah,
Mm-hmm.
you can take too much and your bacteria can start to become resistant. And that's how, like the girl that I mentioned in her 30s
Mm-hmm.
that died of a kidney infection, that's what happened. She'd had so many antibiotics, and this is
Mm-hmm.
extremely rare. So if you're somebody who's been on a lot of antibiotics, it
Right.
doesn't mean this is going to
Don't
happen to you.
freak.
She also had diabetes, and there was other things going on there. But
Mm-hmm.
she had been on so many antibiotics that there was nothing that would kill the bacteria anymore.
Mm-hmm.
And that it was just heavily resistant. So there is too much of a good thing. And we have a responsibility to be smart about the
Mm-hmm.
drugs that we choose to use for UTIs.
Right. Oh man, that's unfortunate. Yeah, because I can definitely see how someone using something consistently, and once you realize it's coming back, there might be a problem of, okay, this clearly isn't working, that I need to figure out. And do you think the accessibility of telehealth, do you think that has anything to do with not so much with people not going to actually see a doctor, but say, for example, if I know that I'm having a UTI because I'm so used to having it and I'm just using telehealth and just filling in the blank, I could be lying just because I want to hurry up and get antibiotics. Is that also a way to basically affect you because you're not really telling them what those symptoms are? You're just assuming just because you're used to it and getting the wrong thing. And well, you're like, well, I did, I got antibiotics. And it's just like, should I have gone to a doctor, or is telehealth, a con at the same time because of that? Because, it's more of just a fill in the blank and not actually doing like a virtual appointment with the doctor.
Well, my opinion on this is no matter where you see a doctor, online, in
Mm-hmm.
person, ER, public health department, we all have the same responsibility. And our
Right.
responsibility is that we must do the best that we possibly can by you. And it's our job
Mm-hmm.
to think through all the potential scenarios of the thing that we want to do for you and act
Right.
in your best interest. So even if I am your virtual doctor, I am just
Mm-hmm.
as obligated as the person in the clinic to say, Symone, you've had 3 UTIs this year, and I know that
Mm-hmm.
macrobid almost always works, but this
Right.
time, even though it's inconvenient, we gotta do a urine test. I need to test it.
Mm-hmm.
I need to see what's in there. And I please don't hate me for it, but I need you to go
Yeah.
to the lab this one time. We
Mm-hmm.
still have that. But I would argue that it's still more convenient to use telehealth because you're
Mm-hmm.
not having to go to the clinic. You're still bypassing that brick and mortar visit,
Right.
but we do need you all as the patients to be willing to take that step if we feel that it's in your best interest.
Mm-hmm. No, I completely. That's great because I even when I was on like TikTok, and I'm referencing TikTok so much just because the comment section on videos are just insane. What people are saying, they're like, "Well, no, you need to go to a doctor." And in my mind, I'm like, "What do you think this platform is? Like, just because it's virtual or online doesn't negate the same fact that it can do the same thing what a physical doctor can do." And I think that's a big misconception that people have when it comes to getting virtual care and choosing to go the opposite route. It's like, no, you can still get the same exact things. You're just not having to leave your house for it. So I'm glad that you expounded on that. And then the holy grail that people love to take, cranberry juice. Is it hype, or is it something that actually that actually works? Because I will say I am a victim of drinking cranberry juice and that's going to solve all my problems, or taking apple cider vinegar gummies.
Happy to talk about that. It is not hype. It's not hype. It's not.
Okay.
So the bacteria that lives in your urine, it doesn't like
Mm-hmm.
an acidic environment. And cranberry juice,
Okay.
and I'm not talking about 5% juice cranberry juice. Actual
Ocean
100%
spray.
cranberry juice. Yeah. No,
Mm-hmm.
not the no, 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 not the sugar-free
Yep.
ocean spray 3% juice.
Mm-hmm.
100% cranberry juice comes in a small bottle. It's like this big,
Yep.
and
At like
these
Whole
days it's
Foods or
about
something.
20
Yes.
bucks a bottle. hard to find, and also hard to drink. It doesn't taste very
Mm-hmm.
good. 100% cranberry juice is kind of gross. Like I don't, like an ounce or two is all I can handle. But what it's doing is it's causing your urine to be acidic. And the bacteria, specifically the E. coli, they don't like the acidic environment. It destabilizes their comfort level and decreases the likelihood that you could get or be colonized or infected by these E. coli. Now, it is more preventive than it is treatment. Is it possible to start taking it with the first signs of UTI and it goes away? Yeah, 100%. However, if you have an actual full-blown infection and you're peeing blood and you have a low fever and you got that pain down there, it's not a substitute. Yes, take the cranberry, but also
Mm-hmm.
call or email WISP, go online and let us actually treat you because it's not going to cure it.
Okay. And that's the thing that I've noticed. People think this is the cure, and it's actually more of like a pain reliever to deal with those symptoms, but it doesn't actually cure it. And that's been the problem. People will say all the time, oh, I drank cranberry juice and it was fine. Or I think there's like these, I don't know if it's called like ACV or something. It's some brand that you can just get at like Target or something. And it tells you on it, this is not a cure for it. It's a pain reliever and a symptom reliever. And I think that's the big misconception. And also people who are chronically affected by it, they're thinking that using these things are going to cure it. And it's no, there's a big difference between just relieving your symptoms and actually curing it. So I'm super glad that you said that, because I have people all the time, oh, just drink cranberry juice or just go do this. And it's like, even with yeast infections, just put, yogurt on a tampon. And I'm like, no, like, no, like,
No,
mm-mm,
no,
like,
no, no.
like that's a double thumbs down for me. Okay, so awesome. So I'm really glad that we definitely focused on the difference between curing something and just relieving your symptoms. So it's not to negate that you can't take these things, but it's not going to be the end all cure all to what you're experiencing. So let's dive into some, fact versus fiction. So when it comes to UTIs, those are solely caused by poor hygiene, like just not bathing properly, different things like that. That is how you can only get a UTI.
Fiction.
I
That
was like, hold
is,
on.
as women, or
Hmm.
let me back up, as people with vaginas, right? Anybody with a vagina, we were built with a really short urethra. It's not very long, which means bacteria doesn't have far to go. And actually, what's kind of ironic is that you can actually get UTIs from bathing too much, from being too clean. You can get urethritis and you can get infections in your bladder from sitting around in bathwater too long and maybe being a little too clean.
Too
The
clean.
fact of the matter is, we are built in a way that predisposes us to allowing bacteria to crawl up our urethras and get in our bladders. Now, that's not to say that everyone should go the next 3 weeks without showering, because then you'll never get a UTI. Not true. There does become a point in time at which the cleanliness of the area may impact your ability to get a UTI. But no, it's not true to say or think that if you get a UTI, then clearly you have poor hygiene. It's just not true.
Yeah, I was like, no, it's not it. Okay, thank you. And UTIs only occur in women, fact or fiction?
Fiction.
Hmm.
However, I will say, we just talked about short urethras, right? In
Right.
women, people with vaginas, people with penises have very long urethras, which means that it is very rare for people with penises to get UTIs. So that's why we can't, it's not as simple to treat. You have prostate infections, you have testicular infections, you have STIs, which can often be more symptomatic in people with penises than people with vaginas. And so, kidney infections, bladder infections, there's so much going on and it's not as simple. So if you have a penis, yes, you can get a urinary tract infection, but actually you must always 100% of the time get a lab test beforehand, because the likelihood that you could get the wrong treatment is actually pretty high.
So it's higher for people with penises for it. Wow. Okay.
Yes. Very rare,
Man.
uncommon, and a more complicated infection at baseline than it is in people with vaginas.
Okay. I did not know that. And then, so is it possible that everyone will have the same symptoms if they do have a UTI?
Not at all. I have heard everything from
Really?
I'll give you some of the top ones. I feel like I have to go all the time. I'm going to the bathroom, but nothing comes out. I have pain in the front of my abdomen. I have pain in my low back behind my pelvis. I have pink urine. I have blood in my urine. I have a low-grade fever. Flu-like symptoms, fatigue, chills, aches, exhaustion. What else? Abdominal pain. Sometimes people can't really feel the difference between the lower bladder and the upper bladder.
Hold on.
Pain with
Upper and lower bladder? Never
Sorry,
mind.
upper abdomen, lower abdomen. Is what
I
mean
was
to
like,
say.
hold on. Okay.
Sometimes people can't tell the difference between what, where in their abdomen they're feeling pain. It might feel high by the belly button. It might feel low, and they'll think it's ovarian. And abdominal pain is really elusive. And any one of those symptoms, or 2 or 3 or 5 or 10 of those symptoms, people can feel them differently. It's not always the same story. Vomiting, nausea, vomiting, that can be a thing too.
Yeah, I heard someone say that as well, that they were vomiting. And I'm like, okay, I've never experienced that. So it's just crazy to see that there's so many different ways to experience a UTI. So that's why, again, it's tough for people to really know what they have, because when you're Googling it, they're like, oh, well, no one else has had that symptom before. So clearly you don't have one. And even when you said pink urine, I'm like, oh my God, the bodies are they're just insane. They really are. Okay, last one. You can die from having a UTI.
Technically, it depends on how we define the word.
Right.
Technically, yes,
It's
you
kind
can,
of nuanced,
but let me break it down. Let me break it down. So urinary tract involves everything from the urethra all the way up to the kidneys. And the kidneys are the organs that make urine up in your mid-back. So you have urethra, bladder, ureter, and kidney. Those are the 4 main components. And when we say UTI, we really are actually meaning a bladder infection. And there's a medical word for that. It's called cystitis. And that's the medical word for a UTI. Can you die from cystitis itself? No. However, you can progress to a kidney infection, and I'll share the medical word with you. You don't have to remember this. There will not be an exam after this podcast.
Right.
Pyelonephritis. Pyelonephritis is the medical word for a kidney infection, and that very often can become a bloodstream infection, which can become something called sepsis, which can very much be life-threatening. And yes, you can die, because that is bacteria in your bloodstream, bacteria around your body. It's a really big deal. But specifically, can you die from a little bladder infection that hasn't spread outside the bladder?
No. Okay. So basically, it would more so be the root versus the, like, this is exactly how I died. Like, no, it perpetuated, and it started out as one thing and it turned into another, and it just kind of escalated from there. Okay. That was a lot.
There's another medical word. The other medical word is called urosepsis. So if you get a widespread, life-threatening bloodstream infection that infects your whole body from head to toe, but it originates from your bladder, we call that urosepsis. And it is very serious. And yes, you can certainly die, but not
How
from the bladder
rare is
infection
that
itself.
experience? Yeah, how rare is that? Because I've never heard of that before.
I see it every time I go to the hospital. I probably have 2 or 3 patients admitted with that. And it's generally older patients. I would say 75 and older is the most common demographic that we do see that in. But yeah, it's very common.
Is there a reason why that you see it in that specific demographic?
Immune system is not as strong as in the younger ages. That is where hygiene plays into consideration more, because a lot of times they may be in diapers, or they may soil themselves, or not be capable of cleaning themselves in a proper fashion. Maybe they live in a nursing home. Maybe they're on immune suppressant medications. Several factors in play there with those folks.
Okay. And now that you say that, it made me think about my grandmother, because she had colon cancer. So I'm not sure what the bag is called, but it's there. And there will be times where she'll call my dad and be like, I can't use the bathroom. And I'm like, she's she's not doing anything. And, I always associate it with like intercourse or things like that. And her hygiene is, top tier, but you already like expounded on being too clean can be a problem. But it would always make me wonder how someone at her age, she's 86, would constantly be experiencing this, and then it'll end up putting her in the hospital. They would have to do the catheter, all of those things. So that's very interesting, but it makes sense now to just due to how, they're being taken care of, or the lack thereof that could cause that to come about. And speaking of, patients, I definitely want us to dive into like a little bit of a story time. And, we can just kind of listen to a patient's story about, her UTI experience and, give our thoughts and feedback on it.
Okay, I'm going to try and stick to the medical details of my experiences with UTIs. So first UTI was on my 22nd birthday. I woke up at about 5 in the morning and was just overwhelmed with how badly I needed to pee. Ran to the toilet, did just the biggest donkey piss of my whole life. And then just really had to pee still, and it really hurt and burnt, and so it feels like it was like a pulse on my urethra. Called my mum, and she was like, "Oh, you got to flush it out." So I spent probably about 11 hours trying to piss myself out of this UTI because I was living in America at the time and didn't have any health insurance. So I was like, and also just generally, as someone from the UK, quite scared to use the American medical system. It just seems very untrustworthy to me. So that was that, yeah. And then that took about 11 hours of sort of drinking large volumes of water and cranberry juice, and then sort of peeing to less and less pain, but sort of pushing through the pain at various different points. And then I had to go to brunch because it was my birthday. But it was about 4 p.m, so it was more of a dunch, really. Yeah, and then subsequently I've had 2 other UTIs, both of which I have thrown up a lot. Both times. First time, my best mate thought I had food poisoning, and they were very rude when I said I had a UTI, which was quite funny. And then last year I got one, and it was so bad I got a kidney infection because I'm really cool and hot.
Okay, that was that's a lot to unpack. She really kind of went through everything we talked about. She went through the cranberry juice, the throwing up. Shout out to her mom for sure for telling her, "Hey, you're gonna have to flush this out." And the last thing, it happened on her birthday. Okay. How do you feel about that? Like, I know it's a lot, but tell me how you feel.
My first reaction is such a common experience. No, even people from the US don't want to use the US healthcare system. I don't like using the US healthcare system. No shame in that one.
Like, come on. No, we don't.
Our healthcare system's terrifying and difficult to navigate. That's why we do telemedicine, because we don't like institutional healthcare.
Coming from a doctor.
Here we are, right? I mean, it is what it is. That's why I do what I do. But my thought is that if you've had 3 UTIs over the course of 3 years and one of them became a kidney infection, urology time, because you got to check and see, is there anything going on in there? And even if there's not, definitely urinalysis with urine culture the next time one happens, because we need to know what bacteria is in there. But I would say that person should not be someone to just try to flush it out or take cranberry, because once you go full kidney infection, that's like the bar's been raised.
Yeah,
and once that bar gets raised, it never goes back down. So that's my thoughts.
Do you think it became, I guess, chronic for her because, one, this was her first time ever having it, and it sounds like she never took antibiotics the first round, because it sounds like she just kept flushing it and then just went on about the day. So maybe it just kind of, is it possible for that bacteria to go dormant, I guess, if you never take antibiotics? Or do you think she actually flushed it all out?
Not for that long. If it was 1 year and then another one a year later and another one a year later, no, I think they probably did a really good job of getting rid of that bacteria and flushing it out. But the fact that it is coming back and it's getting worse every single time, there's something to that. And that would be the thing that would cause me to say either we need to culture it, or, but especially with that kidney infection, let's find out what a specialist has to say about it, so that next time we're better prepared to know what to do.
Got it. And then, so say for example, day one, she realizes that she had the UTI. How long does it typically take for it to progress to that? Is that a couple days, a week to get to, kidney infection status, or there's no like timeline for it?
I wish I could tell you the answer to that. At this point in my career, I have definitely seen hundreds of kidney infections in the hospital and a couple on the outpatient side, but mostly in the hospital. And I've heard everything from I flushed it out and that was a week ago and I thought everything was fine, and now I have a raging fever of 104 and I'm puking my guts out with back pain, kidney infection. And I've also heard I felt fine, and then today I had a fever of 104 and I'm puking my guts out, kidney infection. Bodies are weird.
They really are. They really are. And just to attest to her point about, being from the UK and just trying to navigate this, like myself, I have a corporate job, and, health insurance was offered to me, but I'm like, do I really want to pay $380 a month for insurance? I'm like, no, I don't. So of course I had the opportunity to have insurance, but I declined it just because and then my deductible on top of that was just outrageous. And it was just so frustrating. So for me now, I just budget to where I put money aside for anything that I need to do, like medical wise, just to have to avoid that amount of money being spent every month and me not going to the doctor. So when I do go, I just pull from that budget that I have, and whether it's, through WISP or going to, urgent care or going to see my primary care, whatever it is, I completely understand her sentiments on just not wanting to navigate it or deal with it. But then on the other side of that, when you allow that fear to hinder you from going, then you end up in situations where, your symptoms just get worse. And I feel like there's really no solution to help people or to tell them, hey, don't get health insurance, just go this route. And it's like, no, you could have medical conditions that you don't even know that are probably dormant, and you actually do need that health insurance, and you're choosing not to. And it's kind of putting you in a weird predicament where, if you do get sick and it perpetuates into something bigger that requires you to go to the ER, you don't have insurance to cover you for that. And then those medical bills just start tallying up. So it's sad times, man. It is. It really is. And, just as your experience as a doctor, do you have any, actual sentiments on, navigating this whole health insurance versus telehealth and paying out of pocket? Like where do you sit with that?
My thought is that I'm really grateful that we have so many options.
Yeah.
I think we're getting really close to a place in our society where there is an option for everyone, no matter what their constraints are, whether that's a government subsidized program or the public health department or cash pay telemedicine, concierge based, insurance based, employer based. We are rapidly accumulating more, or cash pay, self pay that you budget and handle yourself. I think that's beautiful. And I'm grateful that we live in a place in time where we do have options.
Awesome. Okay, Dr. Purdy, again, thank you so much for coming on and just giving your expert advice and debunking some of these myths. I'm really happy to have you on board with us for this season and just helping people get to a better place. So until next time, you guys, thank you so much for joining in and listening on to the Whispering Podcast. Love and light. We'll see you guys next time.